some of the things that yesterday and today, really what I'm doing and what my team and I are doing is really providing a compelling reason to act for commissioners, for policymakers, for service design, really trying to make a difference to residents in Suffolk, our businesses in Suffolk, but also the public service organisations across Suffolk. So that's what we're in the business for. And the key objective when SODA was formed, and I'll talk a little bit about SODA itself and who the partners are in a second, it is through combining data. And when we're talking through combining data, it is actually more and more about identifiable line level, so individual level data that we merge and match and link together and build a true local picture of what is happening in whichever space that we are working in, whichever thing. And just quickly in terms of how we're achieving that objective is one of my chief execs, who's one of the leads across Suffolk, always says, Michaela, just tell me the story, just tell me what's going on, give me the evidence. And I keep saying, yeah, but I can't do that because I don't have the wiring under the desk. And he keeps saying, I'm not interested. And I just go like, yeah, but I need information governance, I need the processes, I need the software and the systems and the tools to give you what you want. So when SODA was set up, I was given the permission to talk about it and do that as well. So that was. But, and I think this is where I want to start before I go and give you some examples of how we have shared data across all the partners in Suffolk, and how we are going about linking that data and matching that data and then doing the analysis. I want to start with our impact, because I think without, as we've heard throughout the last 2 days, without the questions and without them actually making a difference at the end, there's no point in doing data stuff or analytics. So over the past 5 or 6 years, we have proven the concept and done a pilot around linking local authority data to NHS data and had a really good success rate. We enabled the distribution of 5.2 million for the winter grant scheme last year. We have a can-do attitude around data sharing. All the partners are really up for it, and it's the norm. We've upskilled 66 of our local analysts, and that's not just in the local authorities, that's a part of the police, the NHS, VCSE sector, and so forth. Suffolk is one of the counties that has a county deal, or kind of on the levelling up agenda. Our evidence base really supported the conversations and brought that deal home. We have reduced overpayments in adult social care when a service user dies. We've reduced the loss of income from social housing tenancies when properties become occupied again from a death of tenant. We improved collaboration between public service organisations. We've reduced the electoral register canvassing resources that districts and boroughs, so the lower tier authorities in Suffolk, have to go through every year. Ongoing improvements to services around criminal exploitation. And we've also secured local funding for in that space to have criminal exploitation teams in some of the localities across Suffolk. Our evidence has supported the setup of a task and finish group to establish that's looking at reducing disparity amongst children and young people. We've enabled over 24,000 calls to vulnerable people and families across Suffolk during the COVID pandemic, and also secured funding for East Suffolk around vulnerable people spaces. So I think that's the key. That's why we're doing things, because we want to have an impact. So I'm going to spend a very short few minutes on how we've gone about it and how we are having this impact, and then I'll tell you a little bit about the what we're doing. So I think our key success to collaboration is that we are engaging with all partners at all levels, and everybody is really clear what the processes are and how they can bring projects into SODA, how they frame a question. We always start with a question, the business issue, we never start with the data. And they are part of the prioritization and the design of the projects as well. So everybody is there. And who is everybody? So I was brought in 2016 as a kind of a Suffolk-wide resource on data and evidence. And as I said right at the beginning, I was asked to tell this story and I couldn't because there was no wiring under the desk. But I think we proved enough in the 2 years that I was there initially to say we can formalize this a bit more, and it doesn't need to be funded through some grants or kind of a central government grant, but actually we're going to fund it locally. So in 2020, we received the go-ahead to formalize SODA, if you like, and we have continuous commitment from all the local authorities. So there are 5 districts and the borough, the county council, the Suffolk police, and what is now the ICS. There used to be 2 CCGs at the beginning, and it's now 1 ICS. We also link into local universities, health, and the voluntary sector. But we are quite small, so there's only 3.5 of us. And I would probably say, at my detriment and my analysts who aren't here today, the most important person that we've employed for the last 2 years is that chap there that points to information governance, and I'm sure you all know why, but I'll make that clear in a second. But we also draw on the virtual network across Suffolk, so all of the partners have committed resources as and when there is a project that requires a certain capability and they have that in their teams, then they will support that. And then that goes all the way from kind of data engineering, IT side of things to the analytical, statistical side of things. We also have, and I think this is a really clear governance structure, and I think this is what I mean by collaboration. So at all levels, we have got people involved from all of the partner organisations that make decisions. So we are commissioned by the chief executive team across Suffolk. We have then a strategic decision-making team that decides what kind of projects SODA works on and where the priorities lie. A management group which is more operational, that clearly tells us we have got the data, we have got the capability, the capacity to do these projects. And then also, most importantly in my mind, we've got the analysts on board, i.e. the people that can volunteer to work on projects and support that. And that's a group actually that's been going for 6 or 7 years. That's something I set up really early on because I realised there was a lack of consistency in all of the organisations around analytical kind of the pathways, the learning, the training, and that's been set up and working really well. In addition to that, we have and I'm not going to show it to you, but it's part of the presentation. If they're being shared, it's a hidden slide, a really clear assessment framework. So a question comes into SODA, and it can be asked by any organisation and by any level in each organisation. I've got this problem, I've got this question, I've got a hypothesis. Can SODA answer it through some kind of analytical product? And we will then assess it in the partnership management group against that framework, and that's then how the decision is made. Most importantly, though, and this is something we tackled from the word go, is we removed the concerns around the information sharing, and we did a top-down, bottom-up approach on this. So we got the group that was in red up at the top. We got them to sign a really high-level information sharing charter. It gives everybody the permission to share data as a starting point. We always say it's a can-do attitude, and only under if the ethical or IG concerns are so big, then we'll go and pile it down. But it is the can-do attitude, and we go from that perspective. And most importantly, we always start, and so this process was developed amongst all the partners, but also aligning with templates and processes. And we don't start with IG. IG is an enabler. We start with the question. We then start with a really wide funnel. What data would we like? How would we like to share it? How would we like to analyze it? And that feeds into the DPIA, into the data process impact assessment. And only then do we start powering back if the IG people are concerned. And we also have an ethics panel. So we haven't used it yet, but there is a project that I come to right at the end that we would like to use it for soon. So I just thought I'd take you through a couple of projects where we've shared data and how we've done it and what the impact was. So not all of the data is kind of massive data sets that flow together and link. So one of the first projects we did under the Digital Economy Act, it was allowed that the registrars actually share data with wider groups and organizations than was previously possible. But nobody ever applied for that. So we were the first to apply to the General Registrar Office to say, can we have access directly to this data from our local registrar? And we would like to have it on a weekly basis, more information than usually was shared. So not just the name of the deceased, but also the next of kin, the date of birth, the cause of the death, depending on the use of it. And can we have it in a format that is in a PDF where we then have to re-enter the data? So we completed a DPIA, we applied, filled a rather lengthy application form to the GRO, and we were given permission to share the data with within the County Council, Adult Social Care and the Blue Badge team, but also the districts and boroughs, with housing teams and the revenue and benefit teams, so that those teams that look after the council tax, the housing benefits and so forth. And actually, I think I would probably say adult social care and the council tax, so the revenue benefits teams are the ones that, if the data doesn't arrive on a Monday morning now, they are the first ones to shout. So it's a real big impact. It is actually waiting on the data. And it's all automated. We made sure that the registrar didn't have another process to complete on a weekly basis, and nothing is ever entered manually, so that nothing can go wrong. So the impact is that, as I said, social care now has access to weekly data. They had no access to this kind of data before. They can close accounts more quickly. There is no overpayment. There is no kind of recouping of overspend. There is a kind of like a softer side to it, because actually we don't write letters to anyone who's now deceased and cause concern or anxious, kind of upset to the surviving family members. And also there are some kind of challenges around the estate. For the other teams in the districts and boroughs, it means that the social housing becomes free more quickly, and it doesn't stand empty as long, because the next of kin has been identified. Blue badges, they've definitely seen a kind of a drop in fraudulent claims. We recently, this is just completed last month, again, this is sharing of data, but not identifiable data. This was anonymized. So the question was, can we understand racial disparity amongst our services dealing with children and young people? We collated non-identifiable data from social services, education, those known to the police, youth justice, and so forth. And then we just compared the rates to the rates of that as the CAF category within the population. And the impact is now, so they've just set up a task and finished group to just look at how they can reduce that. So a real practical example of going in and just showcasing data that has locally always been available, but nobody ever pulled it together. Now we're going into the slightly more meaty stuff. So a few years back, we were asked to evaluate the effectiveness of the services and the interventions that were put in place around gangs, county lines, and criminal exploitation. And so we did all sorts of interviews and just, around the various work streams and how people felt that it was going. We collected lots of intelligence. But most notably, we collated and linked data or line level data on the children and young people that were part of any of those initiatives. So this year, the latest one, I've just received the latest file, it's about 260 individuals, children, young people under the age of 18 that are part of a criminal exploitation intervention. And I've collected the data and got the data for the past 5 years on these individuals from the police, from youth justice, from education and social care. to understand the pathways, to understand, you know, at the point of intervention, how much interaction did they have prior to that, and has it changed afterwards? And we've aligned some kind of cost benefit or cost avoidance to these cases. Unfortunately, not local cost. We were discussing this at lunch, so it's not available. So we had to use the New Economy Manchester State Unit Cost database. But it provides commissioners a kind of understanding around, if I just had a success with 3 of these youngsters and I can take them out of the system, they can go back to school, they're not suspended from school or they're not excluded from school, how much do I save? Is it worth putting those interventions in place? Because actually in the long term, they are cheaper than the long-term impact on that young person. And so the first one we did was kind of around COVID time, unfortunately, but it did secure funding for, like I said, the criminal exploitation teams that was set up across 3 of the locations in Suffolk. And because it's an ongoing program of interventions, we are doing an ongoing program of evaluation. So it's a 3-year program, and I'm evaluating it on a 6-monthly basis. So I don't know how many of you are aware that the Home Office has enacted a new serious violence duty beginning of this year. The partner or the duty holders are pretty much everybody in the local system. So it includes the Police Crime Commissioner, the police, all local authorities, the NHS or ICS at the local level, fire and rescue, and education. So pretty much everybody needs to come together and work and develop a strategy which has to be published by the end of January next year. So we've been tasked to build up a strategic needs assessment to develop the strategy. And I guess we're doing, I think, Michael was talking about it this morning, a public health approach. We look at the evidence and we kind of collate risk factors, protective factors, and build the evidence around what, how serious violence looks in the general population. But where we come in and where we've decided to make a difference was around actually collecting data on victims and perpetrators and witnesses to serious violence crime in Suffolk. So the police data is our starting point. We decided on a number of Home Office codes that we think constitute serious violence. They provided us the data for the past 5 years on all of the individuals linked to any of those offences. We then matched that data using name, date of birth, because we have no unique identifiers, against probation, youth justice, education, social care, adult, both children and adult. We've also included some commission services, so refuges, because domestic abuse and domestic violence is part of those Home Office codes around offences. And we've linked the data. So we've got all the data together now, and we are just building the data warehouse in an Azure platform and linking the data based on name, date of birth. Sometimes we use address as a third qualifier, but it doesn't usually tend to work that well. And we are delivering the output by the end of August. So unfortunately, I can't give you the impact here yet, but basically it will form to provide a really true local picture on what does serious violence look like, but most importantly, who are the affected communities and people and cohorts within that at a local level. And can we see pathways? Can we see suspension leading to criminal offence at a lower level to a criminal offence at higher level? So we're going to try and do all of that kind of analysis around that as well. And we're doing it in such a way that we can then refresh the data on an annual basis, because the Home Office has asked each local area to track their strategy. So there's some kind of performance management element to it as well. So on an annual basis, we can then play back what actually hopefully the impact of the strategy might have been. We also, and this was one project we started in obviously April 2020, because it's COVID related. We were asked to, beyond the shielding list, whether we can identify those in the Suffolk system, those residents that are vulnerable maybe in other areas, not just so clinically, but socially or financially. Because we had our nice information governance process that I showed a little bit earlier, we completed information governance within 7 working days. We collated over 40 data sets from district boroughs, from social care, the NHS shielding list, a couple of other data sets, and flagged vulnerability against that. And that was then used to build an individual person's data, but also at household level. So we did it at 2 levels. And the data set was uploaded into Power BI so that we could really easily look at it on a daily basis and pull out certain bits of information that the system needed. So we managed to link over 145,000 individuals and just over 100,000 households. We had certain cohort filters that we could report back on at a kind of analytical level, and provided, like I said, some kind of output to each of the areas within Suffolk. But we also used it to identify individuals, and then we played back those individuals based on an agreement of how many potentially vulnerability flags they had back to the system, and there were proactive calls made to these individuals to say, beyond this, do you need any further assistance during lockdown or whatever, where at what point we were during the COVID pandemic. And really, really impactful. So it was impactful in terms of just the analytics and actually the outbound calls and being able to give that data back into the system. But really key for us in Soda, and I think Alex would probably agree, and actually the guys here, we basically, what we thought would take 5-6 years to get all of the partners involved and get everybody so comfortable in data sharing, this project did it for Suffolk, because actually what then came, or what has come since then, is the decision that we are going to build what we call the Soda Link data set. So for those of you that work in ICSs, you've all been tasked with building a linked data set of primary and secondary social care. This is the same thing in local authority land, if you like. So the question was, how can we identify, understand, and proactively work with individuals, families, and communities to enable early intervention? And our approach is that we're going to create a single linked data service architecture which can support multiple needs in terms of analysis or contacting or talking to people. We're going to collate identifiable data from all Soda partners on a monthly basis. We've got secure ways of sharing that data, and we've identified all the data sets that are useful and extractable, if that's a word, because not all data sets always are, because the case management systems sometimes used are just case management systems. They're not systems designed to extract large scale data. And it will include data to identify people, but also identify what kind of potential service needs or vulnerabilities they might have. Key is it's not a data lake. We're not going to be able to just do big data on it and just go in it at any point in time. The IG isn't set up for that. At the moment, the IG is set up for pre-arranged projects and purposes. So at the moment, it's quite a wide range, but it is not unlimited. So we can't just go in and say, somebody comes in with a question and we can say, yeah, we can use the Soda Link data set for that. We will have to have clear permission through the IG to do so. So we've signed off all of the DPIAs and so forth, but we're just in the process of gaining the last signatures for the information sharing agreement from the executive. But we already started to build the data warehouse in Azure, just purely because the data sets are very similar to what we're receiving for the serious violence duty, which I previously mentioned. So it just makes sense to kind of future-proof that. So one of the key things, the last 2 slides, In an ideal world, obviously, we are building this data set here from, using police and local authority data, and the ICS is building this lovely little data set, massive data set of primary and health and primary, secondary and care data. And we would want to, obviously, at some stage, merge them, at least on a project-by-project basis. So we've done a test, that's pilot, where we sent about just over 40,000 records from the housing teams and some other data from one of the districts and boroughs in Suffolk to be matched through the Personal Demographic Service at NHS England. And I'm really, really pleased to say that we had an 80%, over 85% success rate. So it is a viable way of us actually gaining a unique identifier into our SolarLink dataset to then be able to work with the ICS linked dataset in the future. There are some other benefits that Solar's brought to both kind of local, regional and national. So we've definitely found that our approach, and it works for Suffolk really well, the evidence-based led agenda has been raised. We are providing innovative approaches because we are allowed to do so. We are sitting slightly outside all of the organisations, so we've got the permission to innovate. Organisations have better conversations because of what we do. Some of our projects have been recognised as exemplar and have been kind of tried to be replicated across the country. Our ICB has taken on some of the solar governance and some of the other areas that we set up, because it works in Suffolk already on one level, why not borrow it for others? And we are really upskilling colleagues across the board. So if you want to go down that route and be truly collaborative and be truly kind of system-wide, these would be my tips. Definitely go where the energy is. Sometimes you just start with a death registration project. It doesn't sound sexy, it doesn't sound massive in terms of the data sharing, the linking and all the kind of cool things you can do. But actually, it brought partners on board because actually it gave them something that they really, really needed and it made a huge difference. You need resilience. I'm sure the grey hairs weren't here when I started 5 years ago, because you just need to just have the same message and say it again and again and again, and until you feel blue in the face, but people will get it. You need intelligent clients. I think we've heard that yesterday. I can't remember which of the speakers talked about it. So it is about asking the right questions and then upskilling at the bottom up and the top down to do so. And then there are some others, but I think I'm out of time before I get the red card. I've already had the yellow card.